Hello and welcome to episode 7 of my Parkinson's journey video, blog, vlog, journal, whatever you want to call it. It has been a little while since episode 6, so now I'm not going to apologize for that. I had a lot of stuff going on. Since my last recording, I got diagnosed with prostate cancer, so that's been a bit of fun dealing with that. I just got done with my radiation treatment for that the day before Thanksgiving, which is about a week and a half ago. So I'm not going to go into all the details on that, but I got my PSA results from my annual physical, and they were a little bit suspect, so I got a biopsy done, which was fairly uncomfortable, and then went through the radiation treatments, and everything looks good. My cancer was discovered at stage 1, so that's awesome, and prostate cancer is one of the most treatable forms of cancer, so word to older guys, definitely get your PSA done on a regular basis once you hit like 50 or something. I don't know. Again, I've said this in previous episodes, but I'm not clinical, so nothing I say should be construed as medical advice, because I certainly don't know what everybody's going through, and I'm not medically trained, but I am just relating my own experiences. So that all being said, everything looks good to go with my cancer. Probably took care of that. I'll be going for regular rechecks every 6 months for the rest of my life because this is going on, but everything looks good. And in other good news, I'm in the clinical trial, which I detailed in one of my earlier videos, to treat Parkinson's disease, and I just had my 1-year anniversary date for being in the clinical trial, and because it was 1 year, I got to have another DATSCAN. So hey, more radiation. I should be turning into a superhero by this point, the amount of radiation that's been introduced to my body, but haven't seen any signs of that yet. Anyway, got my DATSCAN done. Sorry, there's a plane going overhead, you might hear that, and we'll just ignore it. Got my third DATSCAN done, and the DATSCAN, basically what they're looking at, from my understanding, and I'm going to read this because I really don't know what I'm talking about here, but this is sort of what my understanding is, that Parkinson's is characterized by a loss of dopaminergic neurons in the substantia nigra pars compacta. I would just look that up if I were you, if you want to know. This was from a Wikipedia page, but they're pretty, from what I understand, they're pretty accurate as far as things go. So there's a loss of neurons in the substantia nigra pars compacta, part of your brain. And basically, when you get a DATSCAN, in sort of layman's terms, is this two places in your brain that produce dopamine should look like a comma on a page. And what happens in Parkinson's is the capability to produce dopamine gets reduced in usually one side more than the other side, although both sides can get reduced as time goes by. It's why the tremors and other symptoms progress, but there's two sides, one for the left side, one for the right, and usually one is worse than the other. For me, the left side is worse, so instead of looking like a comma, it looks more just like a period. But my right side still has that tail, so it still looks pretty comma-ish. And the left side and right side are pretty much unchanged for a year, so I don't know necessarily that I am on the study drug. Perhaps I am, or I could be on the, well, there's actually 3 levels to this study. One is that you're on a placebo, one that you're on a minimal amount of the actual study drug, and then one is that you have the full study drug. So I don't know what I'm on, but whatever I'm on, maybe between the drug or the exercises that I do, like I do 30 minutes of cardiovascular training pretty much every single day. Some days a little bit more than that, and I also do a lot of walking every day. Like, you know, I get in at least 10,000 steps, including the steps I get during my cardio. So anyway, that's supposed to be really good for Parkinson's. One of the few things that they know definitely helps. So I do it, and so between the exercise and perhaps the study drug, my symptoms haven't changed, or I shouldn't say my symptoms, but from the measurable aspect, I have not had changes in a year. So that's a win and a celebration as far as I'm concerned. My doctor, I went for a exam, which I do pretty much every month, which is one of the advantages to being in the study, is that I get to see a doctor pretty regularly and a movement specialist, which is, you know, fairly rare. There aren't a lot of movement specialists, so some people wait a long time between visits. If they get an annual checkup, that's great. For me, because I'm part of this study, I'm getting a checkup pretty much every month. You know, as the earlier part of the study, it was more often, and now it's about once a month, and that's going to last for another 6 months, because the initial study was 18 months long. At the end of the 18 months, which I asked the study coordinator, who is awesome, what happens at the end of 18 months? Because from what I understood, or I don't know whether I just concocted this in my own brain, is that at the end of the 18 months, they'd say, yep, you were on the drug, or no, you weren't, or you're in the, you know, that light phase of the drug or whatever. But now I find that there actually is another 18 to 36 months of the study past the initial 18 months. And once you get past the 18 months, then they're going to move everybody who wants to be part of the study still to be on the actual drug itself. That's assuming, I guess, that the drug is shown to be effective, which if I'm on it, I would say it's effective, because my measurable aspects have not increased. When I did my exam with the doctor, he actually said that he saw some slight improvements in some of my muscle tension. A lot of times with Parkinson's, people have more cramping, or you get less flexible and that sort of thing. And he said that I seem to have a bit more flexibility. Now, that's just from their perspective. And the study perspective, and I keep using the term measurable progress, or it's not really progress. Your disease is progressing, but the impact on your life is getting worse. So it's not progress. But in my case, my progress has been on a steady level, and it's not getting worse measurably. But for me, and sorry if this is a little bit rambling, I can tell it is, but that's just part of my Parkinson's, is my brain doesn't quite process the way it used to exactly. So anyway, I am seeing a little bit more trembling as far as my capabilities for eating, for example. Like, I have a bit more trembling going on. At the beginning of this, now I've had symptoms of Parkinson's for about, I don't know, 3 or 4 years, and was officially diagnosed March a year ago, so almost 2 years ago, actually, that I was officially diagnosed with Parkinson's. And I've noticed some increase in the amount of trembling that I've had, and a little bit more trembling in my right side when I'm eating. But usually, if I use the two-hand approach, like if I'm drinking from a cup, I can hold the cup with one hand and then grab with the other hand, and I have that stable positioning, and I can drink, or I can eat. I can still eat pretty well with my right hand. My left hand, I have good days and bad days, and it depends where I'm at in my in the cycle of the drugs that I'm taking. So I'm taking the Sinemet 3 times a day. So if I'm earlier in the cycle of the Sinemet, I tend to have a little bit less trembling. So if I'm going out to dinner, for example, my normal time to take Sinemet is 6 p.m. is my 3rd dose. So I'll try to have dinner you know, a little bit after 6, so, you know, 6:30 or so, when I'm really, the Sinemet's really kicked in and there's less trembling. So, you know, recap of this episode. I know it's going on 10 minutes, and I try to keep these, you know, 10 to 12 minutes long. Things are going well. I'm pretty happy. Progress hasn't been, you know, there hasn't been too much progress with the disease. Cancer kind of threw me back a little bit, which I guess it would throw anybody back. I haven't really gone public with the cancer so much. I mean, it's out there now through this video, but honestly, not that many people are watching these videos at this point. You know, maybe my audience might increase at some point, but I'm not keeping it secret. I'm just not broadcasting things that I'm going through necessarily. And this is mostly to try to help other people with Parkinson's disease. So, you know, the cancer is that's a whole nother can of worms, I guess. So that's the end of episode 7. If you have any questions, feel free to make comments on this video, give me some likes, or if you know people with Parkinson's who this might help. I like to say I'm in the beginning phases of it, so I'm just kind of trying to record the steps so that anybody who gets diagnosed can know this isn't the end of the world. It's just, you know, it's just your world is changing, and our world changes no matter what. As you age, things don't work the same as they used to. Some things work better, some things work not as well. So anyhow, cheers, and see you at episode 8, which will hopefully be a little bit quicker getting here than episode 7 was. Take care.